Welcome to the Healthline, issues that shape our well-being. I'm your host, Dr. Andrea Ault-Brutus. In the Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving, complex healthcare system. Today, we're pleased to welcome Suzette Gordon, who is President and Chief Executive Officer of SCO Family of Services. SCO is one of New York's largest providers of vital human services. A mission-driven and collaborative leader, Suzette oversees an extensive continuum of programs focused on education, family permanency, health and wellness, housing, youth justice, and services for individuals with intellectual and developmental disabilities. Under Suzette's leadership, SCO has strengthened its mission and impact across Long Island and New York City. She is recognized for reimagining and strengthening SCO's leadership team, improving program integration, and fostering a culture where every team member's voice is valued. With more than 20 years of experience across the legal, government, and nonprofit sectors, Suzette brings deep expertise in healthcare transformation, organizational governance, and compliance. Prior to becoming president and CEO, she served as SCO's chief legal counsel. Earlier in her career, she held senior roles at New York City Department of Health and Mental Hygiene and served as a trial attorney at the U.S. Department of Justice. Suzette holds a BA in political science from NYU and a JD from NYU School of Law, and is a well-respected lecturer and author on healthcare privacy and the law. Suzette, welcome to the Healthline.
Thank you so much for having me.
I love to start all my interviews with the person's origin story. So I'd like for you to share your origin story. Can you tell our listeners more about yourself and why did you enter into the human services field?
My journey into the human services field was not a planned, mapped out career trajectory. As you mentioned in describing my bio, I'm an attorney with over 20 years of experience. What drew me to human services is the same thing that's really driven me throughout my entire life and career in the law and now in this space. It's really a deep desire to have a meaningful impact, to do work that's impacting other people in a positive way, to do work that frankly aligns with my own personal values, which include love, empathy, and, compassion for others, just to name a few. So I started my career as an attorney in a law firm in D.C. before moving on to the Department of Justice, which you mentioned. And then from there, I worked for a New York City law firm before I fully committed myself to public service work. First at the Department of Health and Mental Hygiene, where I was a Deputy General Counsel and Chief Privacy Officer. Then St. Barnabas Hospital before coming to SCO. What I'd say is that throughout my career, I didn't always understand the importance of aligning your work with your values or even have the language to understand that. But when I made that transition to the Department of Health, I think it was the first time that I had that awareness that what you do has to match who you are and what you value. And I think that that's the thread that's sort of opened up the doors for me and really supported my curiosity about the different positions that unfolded for me throughout my career.
That's amazing. And I've been thinking a lot about alignment in terms of my own work and personal and professional. So I think that's great that you're able to align your values with the work that you do, which is amazing. Mm-hmm. So can you tell us more about SCO and the 6 core services your organization provides?
We often say that we're like this large organization that not many people know about. So I really hope to change that in this conversation. So we are one of New York's largest human services agencies. We have nearly 3,000 employees. We impact 45,000 New Yorkers. We have 80 programs across 100 sites. Because of our breadth and the wealth of work that we do, we organize our work in the 6 core service areas that you mentioned. They are education, family permanency and support services, residential and juvenile justice services, services for individuals with intellectual and developmental disabilities, housing services, and community health and wellness.
Great. I understand within the community health and wellness core service that you have a heavy emphasis on mental health. And with May being Mental Health Awareness Month, I wanted to see if you could share more information about those mental health services.
What I will say is that while much of our mental health footprint is in that core service area, because of the importance of mental health, because clients show up with varying needs, we do believe throughout all of our areas that we have to be able to deliver those services to our clients. So we make sure that no matter what door you're coming in to SCO through, that if you need the support, you're getting the support. But let me focus to your question on our community health and wellness portfolio. So there are a range of services delivered through that portfolio. We have a beautiful campus in Dix Hills on Long Island that we call the Madonna Heights campus. And it's a campus that focuses on women and girls who have faced trauma and who we want to support in their recovery journey. We have an article, what's called an Article 31 clinic. Basically, it's the regulatory body that licenses the clinic. This is a clinic that offers mental health support, be it through group counseling, individual counseling, and the like. Also have a substance use clinic, because on that campus, we have a program for mothers and women who are on their journey recovering from substance use disorder. They also get mental health support, and the moms can also stay with their babies. We also have a care management program. The footprint is not just on Long Island. We also have the support folks in New York City. As everyone knows, the healthcare system is very difficult to navigate, so our care managers help clients in need manage that complex system. So those are a few, but we really emphasize mental health support throughout our portfolio.
Great. And I understand that a lot of times you try your best to partner with government, and you often find that you are the provider of last resort.
Yeah.
Can you talk more about how you work to make sure that people who need the care get the care that they need?
It's a reputation that we're very proud of. Our business model as a nonprofit, as a human services agency, is that we partner with government to deliver services to folks who are having vulnerable moments. So all of those core service areas that I described, we have some sort of relationship with a government entity, be it in New York City, on Long Island, in the state, where we're contracting to deliver these services. Oftentimes, we get referred clients who maybe other providers are not inclined to take them because they're challenging. We have a reputation at SCO for not saying no to a client. I mean, there are times where you can't say yes because, you obviously want to make sure that folks are paired with the best provider who's equipped to deliver the highest quality care. And we're honest about that if we're not in a position to do it. But we raise our hand and try our very best not to turn anyone away so that folks can get the services that they need.
And it's amazing, 45,000 individuals who you help, over 100 sites, which is just amazing. And you talked about the Madonna Heights program in Dix Hills. Can you talk about also your Nurse Family Partnership program? And I know you also have this amazing program called Wonder With Me. So you can talk about those two programs.
I'm very excited to talk about them. So the Nurse Family Partnership program is based on an evidence-based model. Our program, or iteration of it, we serve expectant moms in Brooklyn. We help them through pregnancy all the way through their child's second birthday. Nurses visit the moms, help support them, ensure that they're getting their appointments, give them the necessary sort of coaching that they need so that they can really be well on their way in their parenting journey. Wonder With Me is also a really great program that we have, which is also evidence-based, and it teaches our staff and mothers in the community. There are a host of videos that we publish and training that we offer so that folks can recognize infant mental health, the milestones that a child is making, whether there, or is a need for concern, how to recognize infant mental health. So it's a really beautiful program that I'm very proud of. I am all of my programs.
Yes, great.
I have to say that because then I'll get...
Yes, like, wait a minute, you just mentioned one that you love this one the most, but you love all your programs, which I can imagine are doing such impactful work in the community. But that said, leading an organization during this time where many things are changing at the federal level and it's impacting our local organizations, I can imagine you have challenges that you have to address. So do you mind sharing with our listeners any challenges SCO has in fulfilling its goals and mission? How do you work to overcome those challenges?
Yeah, I mean, there are a few, and they're kind of interrelated. So the first challenge that comes to mind is funding. Because of our business business model, which I described, we get 97% of our funding from the government. The other 3% we try to fundraise or, get support from elected officials and the like. In terms of the government funding, there really is an issue of the adequacy of that funding and the timeliness of payments of those funds from our government partners who we love working with, but it's an ongoing sort of area for advocacy. Another challenge that we face is staffing, which is not unrelated to the funding issue because the way I pay my staff is through the funding that I get from government. As you can imagine, the work in this space where you're caring for folks who are dealing with some real challenges is quite hard, quite difficult. Someone could be making $25 an hour working at a retail store where they don't have a client who is having a mental health crisis to deal with. So there's a choice there. So we're competing with for-profit entities, non-for-profit entities. We may not be able to pay the most competitive wages. So there's always a staffing challenge in this industry. So those would be two of the challenges that I would highlight. But of course, there are many when dealing with a large organization such as ours.
And I could imagine, in that situation, you have those challenges, but I'm sure you're attracting employees who are very mission driven, similar to you, aligning their values with the work that they're doing.
That's very true. I'm actually really amazed at that when I visit my programs and I spend some time talking to our staff. We're lucky to have folks who've been with the agency for decades, they just come and they stay. I think this kind of work where you're responsible for taking care of your neighbors, for helping your neighbors, for supporting your neighbors attracts a special person. What I do try to make sure that we don't do, though, is assume that because folks are drawn that they're not entitled to equitable wages, that they're not entitled to regular raises. I mean, we can't just rely on the mission to keep folks and making sure you're cultivating a good work environment and that we're always advocating for equitable pay for the sector is a priority. But you're absolutely right. My staff amaze me every single day with their dedication.
Awesome. Amazing. And with that said, we acknowledge there are challenging times, but as you sit here, you're smiling, you're glowing, and I'm sure your staff very similar. How do you stay optimistic with the fact that, yes, we are in the midst of challenging times and, the work itself is challenging. So how do you stay optimistic and how do you continue to motivate your staff to stay optimistic?
Well, thank you for the compliment that I'm glowing. It's tough. It's very easy to get down that road of pessimism. But I have a theory, which I have no data to support, but it's just my own personal theory and mantra, which is that there are more good people in the world than there are bad. There's more good in the world than there's bad. Now, my theory is based on my own sort of anecdotal experience. I'm working in a field where I'm meeting other CEOs, other leaders who are good. They're really trying to do this work. They really care. I'm working with incredible people who are good. When I visit my programs, like I mentioned, I spend time talking to my staff. I do often ask them, why do you do this? Tell me about your experience. I see how they're interacting with the folks who we have the privilege to serve, how they're caring for them. So I can't help but to be optimistic. And also, if you're pessimistic, what's the point? It's over, right?
Yeah,
so
yeah.
I want to keep a little bit of optimism in believing that, whatever the challenges are that we're facing, we're going to be able to meet them head on. And I also feel like in the work that proves itself over time. It may not feel like it when something's tough, but it does kind of prove itself. So that's how I maintain my positivity. And then it's also important, I recognize, to be the kind of leader who can inspire others, who can motivate them, who can, let them know when they're doing a great job, when something's really tough, let them know that it's going to be okay. I also try to create space to be honest. If something terrible has happened in our external environment, I don't lie about it. We acknowledge it, but we kind of reaffirm that it means our work is even more important, that folks really, really need us. We are key. So those are some of the strategies that I use. I can't say that it's easy, but that's my strategy.
Well, I'm sure your employees appreciate that about you because I would imagine if you're being pessimistic coming into work every day and you have to inspire your employees.
Probably be a bit of a challenge.
Exactly. As we prepare to wrap up today's episode, I want to just ask you, how can our listeners find out more information information about SEO. And for those who are listening who may not need those services but want to support SEO, how can they find out about that as well?
We are always looking for folks to find out about us, to get support, or friends who want to support us. So for anyone who's interested, you can go to www.sco.org. We have a really great user-friendly website. You can literally search and filter for our programming. If you know somebody who could benefit from one of our services, you can do a search that way. If you want to donate, it's sco.org/donate. If I may plug a fundraiser that we have coming up, it's our Madonna Heights Golf Classic. Madonna Heights is a place that I described to you earlier where we support women and girls recovering from trauma. We have a golf classic on June 1st at the Woodside Club. And if you want to support us, you can go to our website and then search under events, and that's where you'll find all the information.
Good, amazing. And like you said before, if anyone needs any of the services from SEO, they could go to the website, and it's very user-friendly. I've been on the website myself, so they could type in the name of the program or the kind of services that they would need.
Yeah.
Okay.
So they can go to sco.org, and then they can look under programs, and they can filter. They can search, if you're interested, for example, in early childhood, they can go under education. They can look in Queens. They can look on Long Island.
Right.
So you can literally filter your search in any way that works for you down to the location of the program that you're looking for. And then you'll have some contact information to proceed from there.
Great. Well, thank you so much, Suzette, for being on our podcast today. Such a pleasure to have you on the podcast and to have you share the amazing services and work that your organization is doing. So we appreciate you taking the time to meet with us today. So this wraps up another episode of The Health Line, Issues That Shape Our Wellbeing. I would like to thank our studio engineer, John Mullen, and I would like to thank our WRHU Hofstra family. Lastly, I'd like to thank the Hofstra School of Health Sciences for sponsoring this podcast. I am Dr. Andrea Ault-Brutus, and thank you for listening. Have a great day.
Bye.